Hi, I'm Nicole Durr. I am the dental assistant instructor here at Davis Technical College, and we will be doing an amalgam filling today. All right, so we are going to be doing an amalgam today, and this is something where it's maybe a little bit uncommon now because a lot of dental offices are moving toward composite fillings. So the difference with those is your amalgam filling is like the silver filling, and composites, dentists are going towards those for two reasons. They have more of an aesthetic quality to them. So aesthetic is where it looks nice. It's tooth colored, so you really can't tell if anything has been done besides looking at an x-ray or looking at their treatment plan. So that's a nice thing. The other thing is amalgams do have mercury in them, and it has a mixture of different materials in it. And so mercury is one of those things that we need to be careful of, and we need to handle it properly. And so there is the health issue where people are a little nervous about having mercury. So there's been tons and tons of amalgams placed. Amalgam has been around a lot longer than composite has. So for the most part, you're still okay if you're getting an amalgam filling. If anyone's had one, they're all right. You're going to be okay with having one. It's just a personal preference. Some offices will not do any amalgam, and some may still find that the amalgam is the better option to go with. The benefit with an amalgam is it tends to be cheaper. So if cost is an issue, that's something that the dentist might discuss with the patient. The other thing is amalgam, it's okay if it gets wet. If there's any saliva or any water that gets onto it, it's going to be okay because we place it and the dentist will do a special prep in the tooth, a special cut in the tooth to where it kind of locks in place. That's called mechanical retention. And so once it sets up, it's good. But with a composite, you're doing chemical retention, and you need to maintain a dry field. So if there's any water or saliva that gets on that tooth, it's not going to stick. So we need to take that into consideration. If we have a patient where I have an example where we had a younger child where they had a very small area that needed a filling done. And with that, if we were to sedate them, it would be a long time for them to not eat, be sedated, lots of money for just maybe 10 minutes worth of, not even that, of doing a filling. So for this patient, it was a better option to just do an amalgam and just quickly get that little spot done for them. And so we didn't have to worry about isolating the tooth, keeping it dry, putting in a composite. We could just quickly get that amalgam in there and be done. So there are some scenarios where an amalgam is your better bet. Amalgams used to be the better choice originally because composites weren't very strong to begin with. They didn't have the lifespan that amalgams do. Amalgams, you're looking at, depending on how the dentist would do their work, but you're looking at about a 20+ year lifespan, whereas originally composites were probably within a 10 to 15 year lifespan, but now they've improved on the product and it has a pretty comparable lifespan as long as the patient is not doing anything too crazy with what they're eating and chewing, but overall they're pretty comparable that way. So it just comes down to the dentist and what the patient would want. So with the amalgam, we'll just kind of go over what we're going to have on our tray setup. So first we would have our high-speed handpiece, and this is going to have your friction grip burr. It's going to be a pair, and typically I like to have a 330 burr in there. And with this one, with your friction grip, it depends on your handpiece, you're going to push with your thumb the back button of this handpiece and push really hard in order to get that burr to slide in. And this one goes in quite far for this handpiece. Some of them will stick out a little further, but we want to always give it a tug, make sure that it's in there. And when you're setting it down, make sure to place it so it's pointing away from you, because if it's turned this way, what's going to happen? You're going to get caught, you're going to get scratched. If you don't have a lab coat on, you're going to scratch your arm, or the dentist is going to scratch their arm, and then we have an exposure, incident. So we need to be careful with that. So always keep an eye on that. And then with you're going to have your straight slow speed with your contra angle attachment, and this one's going to have a round burr. This one can either have, your contra angle could either use a latch type burr or a friction grip burr. It depends on this part up here. So you can see either one of those. The ones that we have here are only latch type, but my office had friction grip on both high speed and the contra angle. So with this one, we have our round burr with our latch type burr, and we're just going to twist that until we see it pop out the back and lock that in place, and always give it a tug, make sure that it's in there. We don't want any burrs flying out. And then for our setup, we're going to have our aspirating syringe, and so I'm going to have you load that for me. So just make sure to retract that harpoon, bring it back, there you go. And then you're going to turn this, and we want to engage the harpoon. So you're going to take it and give a couple taps on it, okay? Yep, do just a little bit harder. There you go, good. And that's going to push that harpoon into that little rubber stopper in the end. And then you're going to take the tip of your needle. You can set this down just so you have an extra hand. Yep, just twist that. Okay, so when you put that in, make sure it goes straight in, that it doesn't bend at all. And so right here you can see that harpoon is stuck right in there. Yeah. Okay, so go straight in and kind of push to kind of stick that needle part in the diaphragm, and then just twist, twist, twist. And I would bring your fingers down to the side right here as you twist. So hold it right there, there you go, and twist it, because if that cap comes off, then I don't want your fingers in an area where they can get poked. There you go, perfect. So just lay that down. So we have our aspirating syringe. This would have whatever anesthetic the dentist wanted. Lidocaine is pretty popular, so you more than likely would have lidocaine in there, but whatever the dentist wants, make sure you load that in there. And depending on the patient's age, like their size, that will determine how much anesthetic you're going to use. A child will not be able to have as much anesthetic as an adult could, so you'll kind of have to play that by ear on how many anesthetic carpules you'll have out on your tray. You're going to have your topical ready to go, so I normally just have this ready to go with our topical so we can dry the patient's mouth out. And then we're going to have, on our instruments, we're going to have our mirror, explorer, the spoon excavator, the amalgam carrier, your condenser and plugger, your ball burnisher, your discoid and cleoid, your articulating paper pliers, and your cotton forceps. You typically will just have that just in case you need it. Then you'll have a little bit of gauze. With amalgams, I don't really use too much gauze. With composite, I use a lot more because we're cleaning the excess composite off any instruments with that gauze. But with amalgam, you're mostly suctioning any of the excess, not composite, the amalgam. And then you'll have your amalgam capsules. We'll work on that with the amalgamator, your triturator, in just a minute. We also have the DiCal. That's something that you may or may not use. It just depends on if the filling is a little deeper. DiCal is a liner, and so it's going to protect the pulp, and it's going to stimulate the regrowth of dentin. And so we're just going to put that down there just kind of as a little extra layer to help that too, so it's keeps it happy pretty much. With the DiCal, you want to make sure that you have a base and a catalyst. So you'll want to grab the tube. Typically they'll have them different colors, which is nice. You definitely want to see that, but always turn it to the side or wherever it is on the tube and look that it says base and catalyst, because you need both of those to mix it together. You can't have two bases and you can't have two catalysts to mix it. It's just not going to give you the same result. So this is just the brand is DiCal, but you want to know it by the chemical name for it would be your calcium hydroxide, okay? Because there can be different brands besides Dical, so just know that it's your calcium hydroxide is your liner. But most people just call it Dical because it's easier to say than calcium hydroxide. And then you're going to have your amalgam well, and you'll also have your little mixing pad along with your Dical. But again, you may or may not have Dical set out. You could just have it very basic to where you only have your instruments, your amalgam well, and your amalgam capsules. Now with your amalgam capsules, they can be called 1 spill or 2 spill. That just means how much is in the capsule. So your 1 spill, there's going to be less amalgam in there compared to your 2 spill, okay? And this is important to know how much it has for whatever tooth size you're working with. If you're doing an MOD on a permanent tooth, you're probably going to use at least 2 capsules, depending if it's a 1 or 2 spill. That can factor it. But that's going to use a lot of amalgam. Whereas if I'm doing just an occlusal, that may not be very deep, I'm only going to do just a 1 spill, 1 capsule, and that's it. So some amalgam capsules may need to be activated where it'll have like a little end to it that needs to be popped down. So this would be pushed flush with the rest of this gray part. This is actually a cement capsule. We don't have any of the kind that need to be activated right now. So this is kind of the closest that I can come up with to show you. But with the amalgam capsule, if it does need to be activated, you'll have a little it's a little device that you can put it in, and it will pop that forward. Or if you don't have that, you would just push this on the counter, and then you'll put it in your amalgamator or your triturator. A lot of times it's called an amalgamator because what it did was they usually would just use it for amalgam, but the more proper term, I guess you could say, was calling it a triturator because it mixes more than just amalgam, because you can mix either of these things in your triturator. This one would just have to be popped up in order for it to fit. It will not fit when it's like this. It's not ready. When you're activating it, that allows the ingredients inside to be shaken up and mixing together. With most things that we mix, the mixing time doesn't start until our powder and liquid touches each other, or whatever it is that we're mixing. So it's kind of the same concept that starts it. So you do not want to activate it until the dentist is ready for it. So you can't put this in there until the dentist has prepped the tooth and says, all right, we're ready to mix the amalgam. Then you'll activate it, put it in there. This one, since it doesn't have a little button on the back of it, it does not need to be activated, so it can just sit in here until you're ready for it. So when you're setting up your tray, you can just have this sitting in there. Don't push the start button, because again, that's just going to ruin it. Same thing as activating it. That will ruin it if you're not ready for it right then, okay? So we're going to work on putting it in your amalgamator, your triturator. All right, so what you're going to do, you're going to push, and it's a little different where I'm sitting, but you're going to push one end in, and then you're going to push the other side. So try to keep it fairly straight. If you have it at an angle, it's going to be a little odd going in. And these prongs, they stretch apart like this, okay? So when you're taking it out, I normally put my finger behind it and push with my thumb and pull forward. And again, it's a little awkward the way that I'm sitting. But I just pull with my finger and kind of stretch this away. Okay, so give it a try. It'll make a little more sense as you're doing it. So keep it in there straight, so put the end in. Yep, just like that. And then push that side in. Good. Now I want you to try that with just one hand though. With this hand, because sometimes that other hand is busy passing things to the dentist. Maybe he needed more amalgam, but he's still packing something else in. So you're going to be stretching your arms to do both of those things. Okay, so try putting it in and taking it out with just one hand. There you go, and then put it in. So keep that straight. Yeah, there you go. Good. Do it one more time just for muscle memory. Okay. Keep it right down there. Perfect. Good. Now make sure that this stays, that it's in all the way. If this is off center, if it's not hooked right in those little circles, it mixes it quickly. It's going to shake back and forth pretty fast. And when it does that, if it's not snapped in there, it will flip it out of there. And so that's what this lid is here for, just in case that does happen. It's not going to throw it at you, but just make sure that that's something that you watch for, okay? And then when this lid is on, when the dentist is ready, there's a little start button right here. This is your time. This is going to be, typically you'll do it for about 10-second mix, but it can vary with the material that you're using. So you could adjust that as needed, and then you'll just push that little start button when you're ready, okay? So I just want you to know that I do have my mask pulled down just for instructional purposes. When you are getting things ready for your patient, you're going to set your room up with clean hands. Okay, so they've either been washed or done hand sanitizer, and you set things up. When you have your patient in, you're going to put your mask, your glasses, wash your hands or do hand sanitizer, and then do gloves very last. Make sure that those gloves stay nice and clean. You don't want to move your mask up and down because that's going to contaminate your gloves. And we want to keep everything clean for our patient. Plus, it's going to get things on your mask as you work. So just be aware of that. But yeah, I just want you to know this is not something that you do in a real scenario. You'll just keep everything on like you have it. Okay, that's perfect. So, but I will be kind of moving my mask on and off because when we're doing the amalgam, we do need to be careful because the amalgam lets off the mercury vapors, and so we don't want to be breathing that in, okay? If we had a patient that wanted their amalgam fillings removed and replace it with composite, and that's something that they're still trying to decide whether that's a good idea or not, because as you do that, that kind of opens up that mercury vapor again, and so it may be a little, it's hard to know whether taking that out is more beneficial than leaving it in their mouth. So that's kind of a case-by-case basis. And so they still haven't really come up with whether that's good or bad just yet. So we do want to be careful with our amalgam. Oh, and there's one other thing that I wanted to mention with that. In the suction that we have what's called amalgam separators, where it's going to make sure that what goes through the tubing goes to a special area for the amalgam. So it's going to keep that away from everything else, so we don't have any possible amalgam contaminating anything else. And when we're finished, any excess amalgam that we have left over, we can put in an amalgam safe, which I'll have to grab that out in a minute, but it's just a little container that you're going to have, and you'll do that, okay? Now, I was okay to move that cupboard because we haven't done anything with our patient, okay? But if you have done anything with your patient, you'll need to take your glove off, get an over glove, have a clean pair of cotton forceps somewhere so you can open cupboards, because we don't want to touch and contaminate anything else in our room. All right, so let's get started. We're going to get our patient numb first. And so what we're going to do, and I might just do this tooth here since it's a little more forward, we are going to get our topical, so go ahead and grab that for me, along with the gauze. Just kind of pull that gauze away. There you go. And I just use that gauze. We're just going to use that to dry the area. And so what you're going to do, you're going to come and just dry off by his gums. And if we were doing a block injection, you would want to get your saliva ejector and saliva eject any saliva from the back, and then you'll dry off the area, and you'll put some topical back, kind of by the back cheek part, and then you'll also come right by the gums, okay? So I'm going to have you, we're just going to pretend like all that's happening, so we're going to dry off the area by the gums, yep, and then you're going to grab your topical, and you can put that right on there. Good. And just kind of swirl it around right on that area. Perfect. And then that would stay for about a minute depends on your patient. It could be anywhere from 30 seconds to 2 minutes. So I just ask my patient, is that starting to feel numb? And then I'm also going to have we're going to do that little back area. So grab that saliva ejector. We'll pretend like he has some saliva back there. And just suction. There you go. And then you're going to turn that off. You're going to set that down. You're going to grab your gauze, dry off the area. The reason why we're doing that is so this sticks. If the saliva is there, it just kind of slips away and it doesn't really come in contact with the mucosa. So you're going to take that, and it's going to be, yeah, like right about there. Perfect. He doesn't have that part in his mouth, so we're just going to pretend it's right there. You're just going to kind of swirl. Yeah, kind of do a big swirl right there. Perfect. Because you don't exactly have a good landmark to go by for where he's going, so I just get a broad area and make sure that it's numb right there. And then you're going to grab a gauze and you're going to wipe away the excess topical. So you can wipe away what's on by his gums. Once they feel that it's numb, and with kids, they don't know what numb means. A lot of kids haven't experienced that before. So I just say the skin is going to feel a little different, tingly, funny, weird. Try to figure out a word that clicks for them, because sometimes they don't know what those other ones mean either. So I'm like, does it feel different? No. Does it feel funny? No. Does it feel weird? Yeah. And then I'm like, okay, so that's the word that clicks for them. So we want to let them know that's just going to help the skin sleep so we can do the injection, okay? I don't show them this, but I just tell them we're going to put some stuff that's going to help their tooth sleep, so we can work on it. Teeth don't like to be worked on when they're awake, so we have them take a little nap while we fix them, okay? All right, so once we have that, then we are going to pass the anesthetic. Now there's two ways. The book has us go this way. You'll pass it this direction, okay? And the dentist will pick it up from here. If you are, I'm just tapping that in there, the harpoon kind of slipped out. So if this is moving at all, then we want to make sure that that's in there. You just need to be careful when you hit it once that needle's on there, because the anesthetic will squirt through this since it's hooked up there with that needle. Okay, so if you have a patient that's very afraid of needles, this may not work for them, because if they have something that close to them that they're afraid of, they're going to jump out of your chair. So if you have that, then the dentist may have you pass it low and behind their head, okay? So either one of those it depends. Or your dentist may not have you pass it. My office, he would just pick it up, okay? Just to reduce on any exposure incidents, okay? So he'd do it, but just for learning purposes, we're going to pass this. So I'm actually going to have you do this hand. This one will be for over here. If we're doing this hand, it'd be the one that's coming behind their head, okay? So you're going to keep this ring, hold still for just a minute. You're going to keep this ring level so I can get my thumb through there. And then you're going to hold right there with those two fingers. So keep a hold on the actual the aspirating syringe part, okay? Then you're going to use these fingers to kind of loosen the cap. Good, perfect, just like that. And then you're going to back away and make sure you kind of move those fingers out of the way as you move. So you're going to hold onto the cap, and those fingers are going to kind of separate, and you're going to put the cap in our little needle, the cap holder. And then we're going to do the anesthetic, okay? If you have a child, typically you're going to be resting your hands on theirs and just kind of making sure that they're feeling comfortable, doing okay. And if they try to grab, you can kind of keep your hands a little more of a hold at their hands so they don't try to grab, because we don't want them to get poked with this, okay? And anyone else, if they're older and you know that they're doing okay, you're just going to be ready with your suction and your water, okay? So grab your HVE and your air water syringe, because this does not taste very good. It can have a bitter taste to it. And sometimes if the dentist, like this one's kind of dripping a little bit, so if that dripped, the dentist may have you just rinse right away while he's doing it. So if that's the case, you just want to do it very carefully. And so go ahead and rinse for me. Good. Perfect. Okay.
So I suction up the
Yeah, you can suction. You can put right down in that bowl. There you go. All right. So with the topical, you'll just place it, let it get numb, and then you will not rinse that one though, okay? Because we don't want to dilute that topical. But after we've done the anesthetic, then we can go through, give them a rinse, and then we're going to wait for the numbness to kick in. If you did an infiltration injection, that's going to be almost immediately that they're going to feel numb on that tooth because it's just a direct line to that tooth. A block injection is going to spread, so it needs to take time to travel up to the teeth that we're working on. Your block injection typically will go from the molar to the canine tooth, and it's a little more dense through there. So you're looking at about 10 minutes of letting the patient sit, okay? You want to point out to them not to bite on their cheek. We normally would take a little cotton roll. So pretend this is your cotton roll, okay? Little cotton roll. And we're going to put it in and just say, this is, your teeth are sleeping right now, and we don't want you to bite on your cheek. So we're going to put a little cotton roll in here just to keep you from biting your cheek. That's the best thing if you're working with a child because they just don't understand what it is that's going on. And just say if you were to bite your cheek, you wouldn't know that you were to bite it really hard. Same thing for an adult though, because even with adults, they're just like, hey, cool, it feels numb, and they might start chewing on it and not realize just how hard they're biting. So we want to point that out to anyone, no matter the age. Just be careful not to bite your cheek or your tongue because their cheek and half of their tongue are going to be numb, okay? So we're going to wait for the 10 minutes and then we'll come back and see how they're feeling. Now the ways that we're going to check if they're numb, this could be either for you or the dentist, because some dentists may say when they're numb, go ahead and put a dental dam on them if your office uses a dental dam. So you need to know how to check if they're numb. So the first thing what you could do, if you're going from like the least invasive to a little more stronger method, you can take the end of your mirror and you can kind of push on the gum area that you're wanting it to be numb and say, is that okay right there? Okay. If you say, does that hurt? You may have someone give you a false answer on that. Okay, so just say, is that okay right there? And just push to where if you were doing it on yourself, it would feel uncomfortable. Okay. The next thing would be tapping. So going, does this tooth feel different from this tooth? And go far away from the one that should be numb so they can feel a difference. It should feel hollow, okay, or just a weird feeling compared to the other one. Probably your best indicator that they're numb is your Explorer, and you would check, I'll go on here so we can see a little better. You would check the mesial, the middle, and the distal of both the facial and the lingual parts of the tooth, because sometimes you can have an area where they're fine right here, ouch right here. And so we'll need to add a little extra anesthetic in that area, okay? So once we've checked to make sure that they're numb, then we would either place a dental dam if your office uses a dental dam, which that's a really good idea if you're doing an amalgam anyways, because amalgam's really heavy and it likes to fall back and kind of hide around the tongue, and it's pretty difficult to try to suction that out, and we don't want our patient to swallow it. So if you do a dental dam, I would highly recommend that. But we are just going to prep without because it's a little easier to see what we're doing right now. So I'm going to get my mask on. Go ahead and get your, you know what, I'm going to have you pass me the Mirror and Explorer though, okay? Just so we go through the motion of that, because you would pass those to the dentist. So you're going to get the Mirror and Explorer, and I'm going to hold it like this so you know how I want it. So you grab onto those and just follow me this way. That's the position that you'll have, okay? So when you're passing it to me, so go ahead and bring it. Perfect. Just like that. And then the dentist is going to go through, check, and confirm that they're numb before he gets started. Depending on where he's at in the mouth, he may or may not hand the mirror back to you. I'm going to keep it because I'm going to retract the cheek. You never want to retract the cheek with your fingers when you're working with the handpiece, okay? So for you, if you need to retract their cheek, you can use your air water syringe. You could have an extra mirror if you want. It's your choice. I prefer the air water syringe just because I don't have to switch things around, okay? But I'm just going to pass that back to you. You're going to set that down on your tray, and we're going to start prepping. So get your HVE and air water syringe. And you're going to get in the mouth first, okay? So you want to get established because you don't want to be moving the patient's head around when the dentist is coming in with a handpiece, okay? So get that turned on, and you're just going to be sitting right there. And we're going to get this in position. Now this one had an MO, meaning the mesial part of the tooth was cut out. I'm not going to take that part out. I'm just going to show a simple occlusal today. So pretend that that's just tooth structure right there. Because we haven't done the matrix band yet. Okay, so you're going to rinse and dry the tooth. Give it a real good rinse. Do both air and water. There you go. And then blow air to dry the tooth. And get your HVE closer. There you go. Good. Okay, so now I'm going to do, you keep those. I'm going to do the low speed now. And you are going to, every now and then you might need to blow some air. Okay, because sometimes this will get kind of powdery, and if the HVE doesn't suction that, you can blow a little bit of air to help get that powder out of the tooth, okay? Because as he's prepping through the dentin, it just kind of gets like that, okay? So, and it should be okay, because I'm not going to do a whole lot, because this is a pretty small tooth that we're prepping. This is going to feel really bumpy to your patient. It's going to sound really loud because this is close to their ears, okay? So just let them know it's just going to be kind of loud and bumpy. It can even be ticklish to some patients. I had one little girl that just was laughing when we were doing this part. So it just depends. Okay, rinse and dry that. Good. So you're going to set those down. It's really important that we do a thorough rinse and dry on that tooth because with it being powdery, it's like flour. If there's any water left over or if we didn't get all that powder rinsed out, it just gets like a gluey paste like flour would if it got wet. So we want to make sure that gets rinsed really well. And then we're going to be ready for the amalgam if it wasn't terribly deep. But I'm just going to go through a couple extra steps. So if it wasn't terribly deep and we're just doing a very basic amalgam, then the dentist would just check over the tooth and say, all right, we're ready to mix the amalgam, okay? But if it was a little bit deeper and he needed to go a little further, then he will use a few extra things. So we're going to do the spoon excavator. So you're going to grab that for me. And the spoon excavator is going to, you can feel a little more how deep the decay is, okay? So if he felt like he wasn't quite getting all of it with the slow speed, or he's worried about puncturing the pulp, because it's a very thin layer between the dentin and the pulp. If we puncture the pulp, you are no longer doing just a filling, you're going to be doing a pulpotomy, okay? So we don't want to puncture that. If that wasn't the plan, we don't want to do it. Excuse me. So with this, he can feel the difference between the dentin, between the dentin and the decay. Okay, it's going to have a different texture to it. So he can go through and manually do this and ensure that that pulp is not penetrated at all. So I'm going to have you grab a gauze. And you're just going to, kind of like a little finger puppet, you're just going to hold, I usually do these 3 fingers, and you're just going to pinch at it like this, okay? Perfect. So he's just gonna kind of scrape out anything, and you're just gonna pinch that off. Good. And he'll more than likely have you come to his hand because he may have what's called loops, which are like magnifying glasses. And so if he's looking at a magnified space, he's not going to look up and down from there. It's going to make him dizzy. And so he's just going to, you know, kind of have you come up to him. And then he may or may not just let it go. So if he does that, make sure you have a hold on it. And he may just go like that. Okay, so be on guard for that. Okay. And then you're going to set that down. You're going to rinse and dry the tooth because we were just getting any of that excess decay out of there. Okay, that's what your spoon excavator is for. So you're going to rinse and dry. Good. And then you're going to set that down. And now we're going to do the die cal. And you're just going to do a little line. We'll probably have, and this one's really small too. If I was doing a molar, I'd probably have about that long from here to here of a line or a dot. It depends on what you like to do. I was taught with doing lines, but as long as you have equal amounts of your base and your catalyst, that's pretty much what we're going for. And it just depends on the tooth size. We're going to do more if it's a larger tooth, larger area, and less if it's smaller. So with this one, I'd probably do, and you may even be better off with a dot since it's going to be so small, but just squirt just a tiny bit out of each of your base and your catalyst, and just put them close to each other, but not touching. Okay, you don't want them spread far apart because we are doing just a small amount. Yeah, that's perfect right there. That one just kind of comes out fast. And then try to do about the same amount as what you have from the other one. Good. You're going to take your die cal instrument and you're just going to swirl, just use the tip of it, there you go, and just swirl those together. We want both colors incorporated. Yeah, make sure to get all that swirled in there. Now, what you want to do is you want to grab a gauze and you're going to wipe the end of it off because what's on the tip of it is not mixed in. But you're going to hold that, so we're going to make this pretty slick for you. You're going to hold, you know what, we actually would need this one right here and this one in this hand, like that. So then you're going to bring both of those over like this, okay? And then the dentist is going to have that, and then you have your gauze ready to go in this hand, and this one is going to have your dical, your calcium hydroxide ready to go, okay? So he's just going to scrape what he needs. He's going to place that in the tooth. And then you're going to kind of pinch, twist, and pull back. So it's kind of like a quick, like this motion, okay? Again, he may just let this go when he's finished, okay? So just always be quickly cleaning it off, but wondering when he's going to let go because we don't want to drop the instrument. And I wish that they would do a little better job like going like this, like I'm done with it, but not always will they do that. So just be on your toes. Bring this hand down just a little bit because I was having to kind of reach up to you. And that, it's kind of sticking on you. If that happens, you could even take this and flip it this way, and then you have a clean area, okay? Just turn it inside out. Now, when he's finished, if he does just go like this, you haven't had a chance to wipe it. So when he lets go, he's done. You're going to set things down, but wipe that as you go on to set it on your tray, okay? So just give it a wipe and set it down, because it's hard to clean that once it's dried because it kind of gets stuck on that little ball. So he'll kind of reevaluate things, and say we're ready to mix. Now, it doesn't matter how many times you've assisted with an amalgam, always ask if he's ready to mix, okay? Because I've had a couple times where our office, we did quite a few amalgams, and I knew exactly when he would mix, always. He always did it at this certain spot. Well, I would always ask him, and one time I thought, I know exactly when he wants to mix. It's kind of silly of me to ask him because we've been doing this forever, but I asked him. And what do you know, he kind of got looking at it and decided, there's a little something that wasn't quite right, and he wanted to work a little more on something on the tooth. So if I had mixed it, it would have been a ruined amalgam capsule. So just always ask on that one, okay? So then he'll say, all right, we're ready to mix. So you're going to push that little button.
So I put it at
Yep.
10.
It should be good to go, yeah. So just push that. It's just going to mix. Okay, so go ahead and take that out. And you're going to we can push this back out of your way. You're going to kind of pull it apart, kind of like a little Easter egg, the little plastic Easter eggs. Kind of pull and twist at the same time to get that open. And then you're going to have that amalgam in there. Sometimes there's a little garbage piece. I'll actually pop that out so you can see it. No, it won't come out. That's garbage, okay? You don't want that. So if that falls into your amalgam well, pick it out and you can put the lid back on there. So what you're going to do, we have a small end and a large end on our amalgam carrier. So we're going to typically give the dentist the small end first. Since this is a small tooth, it's not going to take a whole lot of amalgam, but we'll go through the motions of it so you can do it. I'm going to show you how I want you to do this. You would have this on the counter, okay, or on your, I normally do it on the tray. I'm just going to put it on the counter so I can reach. But I put my finger underneath this little lever right here, and I'm going to push down on it. And having my finger there just keeps this part from moving up and down. And I'm going to push, and I'm going to kind of like push and slide up. So in real time, it's like this, push, 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 kind of sliding up the side, and you'll feel when it gets full in there, okay? And it's kind of like a cookie cutter. There's stuff all around the sides. So I kind of rub. It's going to sound like a mouse. It's going to squeak, okay? Go all around the sides to cut any of that excess amalgam off. We don't want any of those flakes falling off, and we don't want to lose any of them. Sometimes the dentist needs every little crumb of amalgam, so we don't want to lose that as, he's putting it in the tooth. And then you're going to do the other side. Pack, 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 pack. Rub, rub, rub. Push really hard to get that packed in there so it doesn't fall out, okay? It should be shiny when you have it packed in there and give it enough pressure, okay? If it's not shiny, push a little more, rub it against the side. I'm going to push both of these out so you can feel it though, okay? So you're going to kind of push down and swipe up, okay? Kind of a swipe, swipe, swipe. There you go. Yeah, just kind of, you can just lift it up a little bit. There's just that little piece I know you're trying to get. So kind of turn it a little bit and move it around. Okay, now do the other side. So you're kind of going down in there and sliding up, down and slide up. Okay, yeah, there you go. And so you're just kind of swiping up the side. Perfect. Good. Okay, and so make sure it's shiny. We're going to pass the small end. Be careful as you're passing this that you don't bump the levers. You're going to have it pointing down. Okay, so you're going to hand that to me. You're going to have your amalgam carrier and your plugger. Those are going to be working together all the time. So Anytime you're passing him amalgam, he's always going to need the plugger, okay? So I'm going to place this in here. Now, if you don't have a dental dam, your other concern is the amalgam falling into the back of their throat. So if that's a thing, you might need to be suctioning while you're doing this, okay? I'm not going to have you do it just yet because I want you to just get a feel for this part. It's a little crazy when you're doing all that together, but just know that would be a big possibility, okay? So since this tooth isn't very big, I'm only going to use just a little bit extra. So I'm leaving some amalgam in here. Always get in a habit when he's finished with the amalgam of pushing both ends to empty out any amalgam and just do it over the amalgam carrier, okay? So yeah, just grab that, empty it out. Good, and you're gonna set that down on the tray. I'm gonna have you get the suction and get the ball burnisher. Now with the suction, I'm going to have you turn it off for just a second. With the suction, you're going to be a little further back in his mouth because I'm still using this amalgam. I don't want any of it getting sucked away, but you're just there as a safety net, okay? So go ahead and turn it on now. And I'm just going to pack this in. He's always going to use the small end first, typically, okay? So when you're passing him instruments, just always get that small end ready. You're going to overfill the tooth with amalgam, okay? Just slightly full. So if you're wondering, you know, if you're looking at it and going, does he have enough amalgam? Just kind of look at the tooth and see. Sometimes it gets a little iffy and you're like, I don't know. So if that's the case, what you can do, I'm going to have you set both of those down for just a minute. So set your burnisher down. Good. What you do, go ahead and get this filled one more time because I need just a little bit more, just the small end. Because some dentists may just want you to automatically know if they have enough. And like I say, sometimes you look at it and you're like, I don't know. It's kind of borderline. It looks like he has enough, but he may need to want a little bit more. So if that's the case, what you do is so you're going to have this one in this hand and this one in this hand. So if he does need more, he can grab this. If he doesn't, he'll grab this and there's your answer, okay? But I do actually need more, so I'm going to have you pass that to me. And then you're going to get the plugger, have that ready for me, the small end pointing down. So make sure that's pointing down. There you go. And just have that to where you want to be just before it tapers off on the instrument so I can have all this room. Okay, so you're going to set that down. And then you're going to get your suction again and get the burnisher, the ball burnisher. And just make sure you're holding up here a little more, having that end pointing down. Now, if he finishes with the large end, say the plugger, okay, and he goes to the burnisher and then he's like, you know what, I need that plugger back. Chances are he'll want the large end back. So if he finished with the large end and he wants it back, give him whatever end he finished with, okay? It's not always, that's not always the rule, but I'd say you have a pretty good shot at it. Okay. So when you're grabbing it, good. You want to, I'm just going to go over what we want to make sure to do. You did a good job holding it nice and tight with your pinky, and you want to, when you place it in my hand, you want to give a little bit of pressure when you put it in. So we both are like, okay, I have it, you've got it, we're going to release what instruments we're holding. So you're going to set that down. You're going to get the discoid and cleoid now. Okay, so after we do the burnisher, so the plugger is packing the amalgam in. So you're going to go plugger, ball, carver. That's how we'd remember it in our office. Plugger, ball, carver. Okay, so we're now on the ball burnisher. And then we're at our carver, which is your discoid and cleoid. So have that pinky out, nice tight grasp with that finger, place it in my hand. Good. Now with the discoid and cleoid, you have the circular end, which is the discoid, and you have the kind of spade-shaped end, which is your cleoid. That depends on what the dentist likes. My dentist, he always would use the discoid end, never use the cleoid end. So dentist preference, you're going to hear us say this a lot. We're always going to say it might be different at your office because every dentist has their own little thing. They went to school in different places, so there's always going to be a different preference, different product, things that you may use. Like with the Di-Cal, you might use something that's in a syringe instead of mixing something. That's very possible. So there's definitely more than one way or more than one product in dentistry. So this is just a sampling of what you may or may not do in an office. So it just comes down to the office showing you the way they like to do their procedure, okay? All right, so the carver, your discoid and cleoid, is just going to, so I didn't finish. So with the plugger, that's going to pack the amalgam in. And then your burnisher is just going to smooth it, okay? Get all those rough edges out. But with your burnisher, as you're pushing on it, the amalgam kind of lifts up. So if I push on my sleeve right here, all of the edges kind of lift up when I do that. And so that's the same thing with the amalgam. You're going to go through with that cleoid and scrape away all of that area. It has a little bit of an edge to it. It's not like a cutting edge necessarily, but it's just enough to kind of shave that down. And you're doing a good job keeping your instruments in order. You want to always put them back in the exact place that they came from. Otherwise, you're going to be scrambling if he's like, I need such and such back. You're going to go, where was that? I just chucked it on my tray. I didn't pay attention to where it was. Always put it back exactly where you had it. Okay? All right, so we're going to finish up with this amalgam. Okay, you're going to set that down. And then we're going to check his bite, okay? So you can give him a rinse while you have that suction though, just to make sure that we don't have any excess amalgam hanging out in his mouth. So rinse and then dry this section of teeth because we want it dry for the articulating paper, okay? Okay, so you're going to grab me the articulating paper pliers with the articulating paper. And so what you're going to do, you're going to hold right here, okay? And I'm going to take it this way. You're always going to have the paper to where it's on the lingual, or if you want to think about having the metal part to the buckle. So if we're on this side, you'd have it flipped that way. Perfect. Yep, so flip it back my way. Now, he doesn't bite very well, but you'd want to make sure that your patient, his poor mouth has been used a few times. You'd want to make sure that as you move their cheek, sometimes that pulls the lip over this area of teeth. That area is still numb, and they could bite that and not know. So make sure you have a clear shot when you're getting ready to have them bite. But you'll put that in there, have them chew a couple times. With the amalgam, it's still setting. It's going to take like 20 minutes or so to set. And if they bite too hard, it could break that filling out. It could even do it with a composite. I've seen it once before, but you need to be a little more careful with the amalgam compared to a composite. Typically, a composite is at its full strength once the curing light hits it. But this one, we still need to give it some time. But we're going to have him chew, and I'm just going to tap my thumb on it just because he doesn't chew very well. The point of this, depending on the color of paper, you may have red or blue paper. You're looking for blue marks on the filling, okay? You'll see blue marks on the cusps of the teeth, and that's fine. But if I see blue on the actual filling, then that tells me, oh, that spot's high. I need to go in with a round burr and burr it down, okay? So I'm going to pass that back to you. I don't see any blue marks on the filling, so I think we're good. You would go through, give your patient a rinse in their mouth. If the dentist felt like it needed it, he could ask for some floss, so you'll grab that floss for me. And you'll just have a little piece, and you're going to hold it out like this, okay? So stretch that out good. And I'm just going to take it from you, and then we'll floss and just make sure everything's good, okay? So we're good there, good there. You typically won't need to do that if you're just doing an occlusal, but if you're doing something that's in between the teeth, he'll always want a floss to make sure that there's no rough edges that are going to snag and catch food and floss and things in the future, okay? So we would give them a final rinse. I know we don't have water, but we'll go through the motion of it and we'll refill our water in just a second. So grab your HVE and air water, or if you wanted to, you can do your saliva ejector at that point because it's easier and you're not worrying about their cheek and their tongue. But one way or another, we just want to give them a good rinse so they don't have any yucky flavors in their mouth or any amalgam if there was any of that. So go ahead and rinse. Good. Okay, then you'll turn that off. I'm going to take this down so I can talk to you a little better. You want to ask them if that got all the taste out, okay? Because sometimes there may still be something in there. So just always give them the chance to let you know if there's anything that's not feeling right. So once we get them rinsed, then we're going to make sure that their face is cleaned up, they don't have anything on their face, and then we're going to set them up. If it's a child, I'm going to get that cotton roll in there and talk to them about that cheek and not biting on their cheek or tongue, and get the cotton roll in there, remind them not to chew, and stress the importance of why, because that cheek is numb, they won't feel it. So go over that lots of times, because it takes quite a few times to tell them, and they still could even chew their cheek even after you've warned them. So always make sure to let them know about that. Now with this, you're going to say, all right, you're going to be numb on your right side, on the bottom right side. Your cheek and half your tongue are going to be numb. Depending on the anesthetic, it varies on how long your patient's going to be numb for. So I just generalize it and I just say you're going to be numb for a couple hours. So then if they're numb for more or less than that, it's okay, because you'll have some people that are very exact and they're like, oh, I was numb for this long and they said I'd only be numb this much. So I don't want them worrying about that because it reacts a little differently to different people, and it also depends on the amount of anesthetic that was used. So just say you're going to be numb for a couple hours. You can take some Tylenol or Motrin, your ibuprofen when you get home, and off brands are fine. I just say Tylenol or ibuprofen because that's what people know, but off brands are totally fine. No big deal with that. So that's just going to help with the injection site. It's going to help with the prep that we did. And they can even take some before they come in, and that way it will be already working in their system. Okay, so either one is fine. We want to wait until the numbness is gone before they eat anything. Okay, that's a really critical thing. However, you'll have plenty of patients where they come during a lunchtime appointment, didn't have time to eat lunch yet, and they're like, man, I'm starving. can I eat? My answer would be, can you at least wait 20 minutes just to make sure that amalgam can set? If it was a composite or something like that, then we're okay. We just need to watch out for that numb cheek. But if it's amalgam, I still have to let it set. So say, just give it like 20, 30 minutes, let it set, and then you can eat something soft on the other side of your mouth, something that you don't have to chew. And then give them examples, okay? Like pudding, yogurt, a smoothie, mashed potatoes, something that's just more of a swallow, kind of hold it in your mouth and swallow item, okay? Because anything that's more of a chewing thing, your cheek can slip in and you could bite it, okay? Even if you're being really mindful, it's holding itself a little differently when it's numb. So just be careful with that. Soups are a little trickier because they don't know the temperature. Half of their mouth is numb, and they may not have the control to close their mouth all the way, so it could dribble out. So you can just let them make that judgment. Food restrictions for the length of having the amalgam in your mouth would just be anything in dentistry. I would stay away from the really, really sticky things that are hard to open your mouth again, okay? So I'm not talking about gum. I'm referring to like taffies, really thick taffies or really thick caramel, something when you're opening your mouth, you're working hard to open, and it's going to pull, okay? Because especially if the amalgam is a little bit older, it can be a little more brittle and it can break out. My mom actually lost part of her filling when she was eating one of the big hunk candy bar things. So you can lose a filling from those types of things. So just have them be careful. I'm not saying you can't have it ever, but I'd just be careful. Just for longevity purposes. Let's see. Sensitivity. So depending on how deep it is, we could have a little more chance for sensitivity. If it does, we can say we put a little liner in there that's going to help protect it and try to stimulate the regrowth of that dentin. But sensitivity is common, okay? We're putting in a substance in the tooth that's never been there before, and it's going to expand and contract differently compared to the tooth, okay, with hot and cold things. And if we are closer to the pulp, it's just going to be a little more tender with things, okay? So sensitivity, they'll feel that for, a week, maybe 2 weeks. But if it's fairly significant and it's getting into the 2-week period, then they'd probably want to call the office and just let them know what things are feeling like. So the dentist can decide if that's something that's okay or if it's a concern and they need to come in and just take a look and see if there's any problems, okay? So that would be everything that we talk to our patient about. So we're going to say numb for a couple hours, Tylenol or ibuprofen when you get home. You're numb on this side, half your cheek and tongue. Wait the 20 minutes, something soft that you don't have to chew, and just avoid super, super sticky things. And sensitivity is common, okay? And that is pretty much it for our amalgam filling.